That's not what the article says, so you'll have to subscribe to read, but you could also
I'm telling you, call the expert, call the kid. 314-863-0008. It's important. So I was going to say, Erin, again, we do offer coaching sessions. Folks know that, whether it's for healthcare purposes and or for also helping them create their retirement game plan, obviously including their investments and all the other important questions. Easy to do. You can call our office, 314-863-0008, or send us an email, jeff@jblfinancial.com.
Or Erin at jblfinancial.com.
Or go to our website. We'd love to do that. And Erin and her staff do keep the last 6 to 8 months of these newsletters archived for your viewing, downloading, printing convenience. But there are a couple of other ways, if you're really wanting to
stay in touch with us every single week.
There you go.
Every single day, truly. You can follow us on Facebook at JBL Financial or follow us on Twitter at JBL Financial. And we like to post current articles, things going on around St. Louis and Illinois.
And they're fun stuff, not just boring money stuff, you know?
No, we try to stay away from reposting the news because we know that many people have their favorite news outlets and take the opportunity to read those news articles, but maybe a different take on what's happening in the news, or some fun articles about saving for retirement, how to save money in travel, also just some fun tips and tricks for fun things to do.
And we do get a lot of fun feedback on that. So like us on Facebook because we like you.
That's right.
Right? We love to
be
do
great.
That. It would be great. And also we do have Twitter as well available for us, right, Erin?
That's right, JBL Financial.
There you go.
Find us.
Find us. We'd love to hear from you. Good. So I think before we take our first break of the hour, I'm not tired. Let's get rolling, right?
Hasn't even broken a sweat yet. That's
Phone
good.
lines are open. We'd love to hear from you. 969-KTRS, star KTRS from your cell phones, unless you're passed out from watching the ball game. 1-888-550-KTRS. Go Tigers.
They've already gone. It's already happened.
Well, we're saying go for next week.
That's fair. That's fair.
Going, gone, etc. Not in the national championship, but
we'll see.
It's all good. Cool. So, Erin, let's again continue with our questions, discussions, things we had about healthcare. You know, this transition to healthcare from actively working, it's scary. I mean, it is. I mean, it's frightening because your employer has picked out your plans for you. You've chosen an option under those plans, but you're really going into a whole new system, which is really government primarily sponsored, really highly regulated. To the good side, by the way.
That's right.
Through Medicare. And making that transition, doing it in the right way, not incurring penalties, this is all important stuff to know. Whether you're choosing a traditional plan or you're choosing a Medicare Advantage plan, the more newer size plans, are really questions about which ones make sense to me, and we talked a little bit about those last week, but let's assume for a moment that you visited with Erin.
Wow. Okay.
You're smart. You visited with Erin. She helped you. She looked at your doctors, your physicians. She compared the plans for you. She laid out and made recommendations for you, and you found, like most clients that we visit with, or many of them, I'm not there, which is why the meetings go quickly, is that your physicians are participating in both a Medicare Advantage HMO and also a PPO plan. If that really is the case, which is better?
Funny you should ask that, because I've been asked that several times just this week.
Well, I know that. That's why we prep for the question, kiddo.
Well, I'm just saying that this is a popular question that people have, especially because as we look over the last 20, 30 years of healthcare, just like any other industry, it's been cyclical. When HMOs were originally created, they were fairly restrictive. You had to use doctors that tended to be in the same hospitals. You had to go to your primary care physician first, take your referral to the specialist. You had to be released to the specialist. And that's what people really remember because they became incredibly popular when they were first introduced to the market.
I think you could probably characterize that well in saying it was, especially in getting a referral, it was mother may I.
Yes.
Your primary releasing you to go to a specialist.
But you're essentially asking permission from your primary care doctor, and you had limited access to physicians because the networks were fairly small. Then over time, the networks became significantly larger, and we also started to revert back to a PPO style plan, and so the HMO style plans really fell out of favor. We saw PPOs become incredibly popular again, but now, especially with the advent of the Affordable Care Act and with these Medicare Advantage plans gaining popularity, we've seen that there's a significant rise in the number of HMO style plans again. However, they've really taken a different form now. United Healthcare created what's called the Open Access HMO, and I think that's a true characterization of what most HMO-style plans are now, especially under Medicare Advantage, where you have a very large network that's maintained by Medicare. The insurance companies cannot narrow these networks because they're required to keep a certain number of physicians accessible to those individuals enrolled in the HMOs. And instead of being released to a specialist, you're really, instead of saying, "Mother, may I?" you're saying, "Mom, I'm going." You're just letting the primary know that you are going to see a specialist. They can't deny you referrals. They can't ask you to come into their office first. You don't have to go in and pick up a piece of paper. Everything's done electronically now.
Which is very cool because, all these networks have really grown large and robust because it was all really about steerage, which was steering folks into managed care networks and plans. That's why through corporate healthcare we saw, the same advent where we went to PPOs, HMOs, et cetera. Now everything on that side has kind of gone open access.
Yes.
And now you're really seeing that, and it isn't really much different. The key point here in the question is that if your docs are in both.
Right. Well, and that would be my next point,
right.
Which is because the HMOs have really loosened those restrictions that people remember from the past, it makes a lot of sense to consider the HMO-style policies for a couple of reasons. First of all, the usage is generally less expensive under the HMO because you're using in-network physicians with the HMO and the PPO, theoretically. The copays are generally slightly lower.
So give us an example.
So with some of the policies, you have a $10 copay to the primary on the HMO side, $15 on the PPO side, $45 for a specialist, can be up to $50 for a specialist on the PPO side.
So they're less expensive, but you're seeing the same doctor.
You're seeing the exact same doctor, but the PPO makes it slightly more expensive for you. Also, the HMOs have zero premium. The majority of them do. There are a few HMO-style plans that do carry a premium, but the most popular...
Yeah, we don't like them.
Exactly. Most popular in St. Louis and Missouri and Illinois are zero premium. In addition to that, their out-of-pocket maximums are significantly lower. You're looking at about $3,000, depending upon which company you select. On the HMO side, on the PPO side, it's between $4,900 and $6,000 in out-of-pocket maximum. So you're really changing your liability just to not have to make a phone call.
And you're really talking about, when we talk about the out-of-pocket maximum, what you're really referring to is basically everything except the drugs.
Exactly. Everything you do medically related, and most people don't even consider things like copays to the primary or your specialist part of this, but they are. So cool. Every dollar you spend that's medically related, aside from prescriptions, goes towards these out-of-pocket maximums. And because all of those numbers go towards the maximum, when you hit that number, if you happen to hit that number, you don't pay for anything else for the rest of the year except for your prescription. So no more copays to the primary if you're admitted to the hospital, things like that. So it makes a lot of sense to consider where you want your liability to be. If all of your physicians fit in the HMO-style plans, I think that I tend to gravitate towards those for those reasons, which is we can limit your liability, we can limit the expense of your usage on a monthly basis and an annual basis. And you're not really losing anything because we can see about an 80% overlap between the networks. So unless you're forced into a PPO-style plan because your physicians don't fit in the HMO, I think you would really want to take a look there first. And the great thing about Medicare Advantage is you get to try it out. So in the first year, if you say, I really don't like this HMO-style plan, I want to try the PPO, during next open enrollment, you can switch without underwriting. And
I think it's interesting, Erin, because, I'm kind of on the sidelines watching you go through this process with our clients. I have seen in the past folks that have, for their own reasons, and, maybe it's more fear factor than anything else because of moving, where some have initially enrolled in the PPO.
Yes, I tried to do my song and dance for them during their first meeting, and I actually recall last year one of our beloved clients, she came in and said, "Erin, there's this zero premium plan. Why didn't you tell me about it?" And I said, "Sweet client of ours, I tried to convince you of this several years ago, but you wouldn't be convinced." And now she switched over to the HMO style plan. We had a chat about it, and she's happy because
I was going to say,
premium.
and it's really a comfort level thing. And I was just going to ask, I don't know you have an exact number here, but as a percentage of those folks that have initially enrolled in the PPOs, have most of them, or what percentage have really switched over afterwards?
The majority of, I would say over 90%, if you've tried the PPO, you're comfortable in the Medicare Advantage side of Medicare, that most people end up gravitating towards the HMO style plan because once they see the money that they're saving, they want to save more, and you can do that with the HMOs. The only time that people end up staying in the PPOs, in my opinion, is if you're an individual that has a primary care physician that isn't actually a primary care doctor. You're using them as such. Many women use their GYNs as primary care physicians. We just
saw somebody last week who was using their allergist.
Exactly, someone using their allergist. And in many cases, physicians started out with one type of practice and they slowly morphed into another. Right. And the insurance companies determine what type of physician is in their network. So they could be in network as a specialist, but if you use the HMO, you have to have an in-network primary care doctor that's labeled as a primary. So some people don't want to make that switch. The PPO is still a great option for them because they don't have to add a primary care doctor if they don't want to. They still have access to all of their physicians, hopefully in network if you've selected a plan that carries all of your specialists. So you still have access to everyone.
So what happens if you've chosen the PPO and like in the situation you're discussing, but you find out that you need to have a major hospitalization situation, planned surgery, something like that?
So it would work the same as any plan that even as your group health insurance plan. It's just, unfortunately, instead of having the $2,900, $3,000 out-of-pocket maximum, you're looking closer to $4,900, $6,000 out-of-pocket maximum. And generally, if you're hospitalized for more than a couple of days, you will hit those numbers because of the expense. So in other words, what are you saying is that the in-network hospital, which would have been in-network anyways, isn't in-network anymore? Depends upon... Well, it just depends upon the plan and also the hospital. If you have an in-network hospital and you have a surgery, even if you don't have a primary with the PPO, you still have in-network benefit. Now, if you have the HMO, then you wouldn't.
I've got you. Okay. Well, sure, because you wouldn't go. Your physician generally doesn't have privileges, or your surgeon doesn't have privileges at a non-network hospital.
That is true.
So that would kind of preclude that. So I can kind of dig that. So generally, unless you have either one physician or multiple ones that are not participating in that network, the modern HMO is really the way to go.
Yeah,
it's less expensive, it's less out of pocket, it's less premiums, and frankly, it's just better.
It is better, and I think that the nice thing about Medicare is these aren't family policies any longer. So husband and wives can choose different policies because in a lot of cases they have different doctors and prescriptions. So you can find the plan that fits you the best. You don't have to worry about your spouse.
Cool. So I guess you really answered another question we had a lot, which is how do referrals to other physicians work under a Medicare HMO? And it's a call-in, isn't it?
It's just one extra phone call you have to make. You can also work with the individual in your primary care doctor's office that makes referrals. Usually there's one or two people that do that. You can ask them how they prefer to receive referrals. We have some doctors' offices that are happy to take them on paper at the beginning of the year. I'm going to see a cardiologist 2 times, or they will take multiple referrals over the phone in one phone call. So I know I'm going to see the cardiologist 3 times this year. Can you make those 3 referrals? Then you never have to call back.
Well, cool. And here was a big question. This one was probably like the number 2 question that I've
been holding out.
I've been holding out, but folks, they have this question, and this isn't really answered on the TV, on the radio, et cetera, and a lot of times in the office of an agent per se. But how do Medicare Advantage plans, or do they pay differently for services I receive if I'm traveling? I'm out of the network area.
Out of the network area. So
do I have coverage?
With all of the major carriers with Medicare Advantage, You have urgent care and ER coverage in the United States at in-network prices, so you pay the same exact rate if it was in St. Louis or if you went to Florida and you needed the ER or urgent care. If you're admitted to the hospital through the ER, you would still have in-network benefits. So it's considered an emergency. If you're traveling internationally, you have ER coverage at in-network prices. United Healthcare and Coventry offer the ability for you to actually move your network. So if you are someone that likes to get out of St. Louis or Illinois and
we're insisting on this. I insist clients get out of town during January, February because it's horrible. The weather's horrible generally down here. It's cold.
You're not even here. It's just
I'm out of
abandoned.
town, baby. I work from out of town.
That's true. So if you are an individual that spends extended amount of time in another place, then you can actually move your network with you. You take your current policy, and as long as that carrier has network availability in the place that you are, you can call them and say, I'm in Miami, and I want to move my network. And you can actually create a whole new group of physicians in that area. And then when you come back to St. Louis, you move it right back and call the insurance company. They carry all the money that you spent somewhere else follows you, and you have your network back in St. Louis. So you have a lot of flexibility with these policies.
It's good. And Erin, I just want to remind everybody that, there are two sides to this house. There are the traditional plans, as you like